Okay, so we're group 9, and we're going over the article Relationship Between Joint Shape and the Development of Osteoarthritis. This article was written by Julie C. Baker LePaine and Nancy E. Lane. They're from University of California, San Francisco, Department of Internal Medicine, and yes. So we'll kind of be discussing the article and any questions we have. So to start,
I'm Reese.
Oh wait, I'm Bella.
Ella. Natalie.
Perfect.
Yes.
All right. So in the introduction, when I was going through it, it said the main takeaway that I had was that joint shape is a key predictor of osteoarthritis.
Yeah.
Yeah, and they said basically there's like different kinds of primary or idiopathic, or there's secondary osteoarthritis. And I think we kind of focused on the secondary throughout the article.
Yeah, I noticed that because I noticed for like the secondary, it was just saying like it's identifiable or predisposing, and then like later we can talk about it later, but like in the embryonic stage with limb budding, it was talking about how if there's like a mutation or like something that's maladaptive, it will most likely cause it later after the child is born and grows. But like for the primary, which you were mentioning, that isn't really talked about as often, it was just like chronic mechanical damage. So it was just like
Overuse.
Over the years, it just happens.
I thought it was interesting too that it said, although it was hypothesized as early as the 1960s that the joint shape is a key predictor of osteoarthritis, the idea only has recently begun to be further explored. So one of my questions, I guess, was like, why do you think that is?
I think I was watching a true crime documentary and about John Benet Ramsey, and they had a 100% idea who it was in the 1960s, but their DNA machines were faulty, and so the case has been open since then. And then they just recently, like a couple years ago, were like, wait a minute, we have the technology to do this now, and then redid it. So I think technology and like accessibility to certain research methods being updated definitely is like
a big factor.
Yeah,
for sure.
I think it's also just like now like that we have the ability to see things that like we couldn't. So like literally, like I mentioned earlier, I think it's so cool, like embryonic development and like how babies are formed. I find it so fascinating. So like I really like took into that a lot and I really absorbed that a lot. But I feel like previously it wasn't really even known like how things work in that situation. And so again, like the more research, the more technology that we have, it's able to happen more.
I also was thinking that so I read the book like Being Mortal, and it was talking about how like like long ago, like in the 1960s, like grandparents would usually like live with like your family. And so now like the like the prevalence of like senior living communities and like that may be more like, I mean now like grandparents, especially for my grandma, like she ended up like breaking like part of her arm because she was on a stool and like trying to get something, and because they think they can do it, and so that could be technology in that, maybe a mix of both.
Also popularity of like the condition, like it may have been like really popular in like the 60s. They took a pause. It wasn't really like a super common theme. Like when they were getting more and more supplies to be able to do research, there were more diseases and conditions that were more prevalent that kind of took priority. But I think maybe there could be like an uprising and like because also like this age is like very like active. I guess like it's not really, but a lot of people in this age are very active, and so it could definitely be more noticeable.
I feel like as like people say like when you don't have war in the country, you can focus on like the arts. I feel like kind of like when we're not having other things to like, people aren't dying as young, people aren't having all these other like conditions that kill them quicker. As people now have the ability to like get older and like flourish, they're not in that like fight or flight mode, then they develop these like chronic things because they get to be 70 years old. They don't.
I mean, I also just think about like how much recently like health has been taken into idea. Like before, you usually see like signs that are like wash your hands for 30 seconds, and you're like no. But then like once like after 2020 and like COVID and everything, it just like blew up so much more. It was like on the rise for like the need for more nurses and like health professionals, things like that, and like trying to focus on things before they became something so big. I think that's also why osteoarthritis has kind of like come up more often. It's just that the more that like, you know, our world grows and everybody kind of like changes and health changes, and as well as like, you know, technology and research, it's like you can kind of like pick up on things more often before they become bigger.
I feel like medicine's definitely a little more preventative than it is treatment, like it was in the past.
Yes.
So more research is going into like the root causes of these things.
No, I was really shocked. It was when it was talking about like osteoarthritis in the hip, talking about how it's most common. I found it was kind of strange that it was like it's very rare to happen in like African Americans or Asian people.
The cultural was really interesting to me.
Why? Because I do know like there are certain cultures and areas in the world where like they have perfect like dental bone structure because of how they live and how they eat and how they fuel their bones, and so that changes things. So I wonder if that has something to do with it. But I was thinking like, what if it's like the terrain, lifestyle, or like nutrition,
something.
I have an idea.
What?
So America's like so lazy, and like other countries are not. And so think about it, like when we get older, like people in other countries, especially like Africa and like Asia, like they don't stop being active and going out and doing stuff until like their last breath. Like you'll see like these 90-year-old people out working in like farms and like agriculture and stuff like that. But here, once you turn like 70, you're like down for the count. Like you're watching Dance Moms every single day, which like
very relatable.
Yeah, but I just think that also because like since people here, once they get to a certain age, they don't do anything. They just sit around, they watch TV, they go pick up the grandkids. Maybe like your bones start to like stiffen and get used to being like complacent, so then when you actually do use them, they're more prone to like get hurt.
Well, I feel like that's also with like bone atrophy. Maybe like it's possibly like when it was saying like mechanical damage, like yes, that could do it, but also if you aren't just like using your body the way it should be used in general, it's going to slowly weaken. Also, like something that I find so interesting is like osteoarthritis, though you think it's like, oh, it's like the grinding of your joint, it kind of like it like tears it apart. People who are like obese or like struggle with obesity, they don't have bone problems at all because the pressure being placed on their bones forces them to stay strong and healthy. And so they are like also a part of like, I guess, the rare population that like though they may have many other health complications, their bone structure is usually often like the strongest and the most healthy.
Later in the order, keep it in.
I wrote that question down because it says at the end, evidence linking BMI to osteoarthritis of the hip. They found that patients with a low BMI had an increased risk of incident hip osteoarthritis.
That's so
like,
interesting. And I googled it and it said the opposite on Google, but that was like the AI text box probably wasn't
like the Gemini.
It was just saying it was like the more weight is more like grinding and force, but then if you don't, so I don't know, I thought it was interesting.
I think it might have been thinking like weightlifters, because like often they do suffer with like just like deterioration, and their cartilage breaks down and it becomes more difficult. Like if you see like those extreme bodybuilders, like their muscle and their physique is like top notch, and runners, it just becomes like it's overused. But when it's used, like if it's constantly used, but like for casual, I guess, or like leisurely proper reasons, like walking, going up the stairs, things like that, it's like that's like the proper way to use your body, because like obviously like our bodies, like it's very draining to do like intense like athleticism and things like that. So I feel like that would like maybe that's what it was mentioning, and it wasn't really thinking like, oh, like if you have a high BMI, like because like we do know that's the opposite.
I also, going off the cultural thing, I know, I was kind of thinking in other countries, I feel like people they exercise, but it's more like a low impact throughout the whole day because they have an active lifestyle. But in America, it's like you sit, do your desk job, and you go do some intense workout, or you go on a run, or you go lift weights, or like you're an athlete, so you're doing like intense sports. So I feel like America has the extremes, and other countries have like it's very mellow, neutral, constant, which is probably better on their bodies than the like.
I always think of like, it's my favorite whenever people go to visit like foreign countries. I often see most often is like Japan or European countries, such as like
wait, I am too.
That's so cool.
Wait, we'll talk about this after video. But yes.
But yeah, I always see like with those, like it'll be like on like their social medias, they'll say like, look how much weight I lost in like a month in eating here. When you don't like, and they're like, everybody's like, oh, it's because their food is better. It's not processed.
Which
It's
is
yes,
real,
the
but
food
yeah.
is processed.
It's the lifestyle.
But even if you ate terribly, if you were to use your body the way it's supposed to be functioning and you're not like staying sedentary, remaining sedentary, it all like, you know, it will react. You will lose the body weight that wasn't supposed to be there. I feel like it's also the same as, though this is off topic, but it's very similar to like culture, is like your muscle changes if you live a sedentary desk job, especially your glute muscles and your hamstrings, they flatten, they start to change, and so everybody's always like, now I'm like standing at my desk because I'm scared for this to happen. I feel like it's just the same. Like America has a very, like you were saying, like two extremes. Like you're either just like sitting all the time doing absolutely nothing, or for like an hour or two a day, you're doing the most intense extreme workout to make up for what you could have just been casually and leisurely doing all day.
That kind of reminds me of like a while back, I used to like work at my gym, and so I would be like, I would go to the gym once a day, work out for like an hour, go crazy, and I still wasn't like losing the weight that I wanted to, or like getting toned where I wanted to. And then I started doing Pilates, and when I first started, they were like, okay, we're working with 3-pound weights, and I was like, are you kidding me? Like, I'm not gonna do anything. And like 30 minutes after like a workout with a 3-pound weight, my like arms were shaking, and then I like after like a week of doing that, I started seeing like actual progress.
It's
like taking it like slow and steady, like low-key sometimes does win the race.
Like knowing your body the way it's meant to move, it often like is just so different.
Well, that kind of made me think when we were talking about European like people. It said okay, I don't know how to say this, but vestibular
vestibular
dysplasia, yes, is quite common in Europeans with a prevalence of 3.4 in one large Danish series. So I don't know, I wrote down besides that, like maybe because they're walking more, or like because their lifestyle, they're putting more, because that's kind of what, like the opposite of what we were talking about, though, right? Like just now. So like maybe it's because they're like, you know, walking more like to and from, like instead of driving, or like I don't know.
Yeah.
Just putting more pressure, like low impact.
Yeah.
But it causes the.
I think that also is just like with different like races and ethnicities and things like that, like your like body types do change. Like certain body types, or for certain races, like they are very slim, and then like other times they're very like, I guess, like the athletic build. And so I feel like also just like with that, most likely it could be just like the gene anatomy and things like that, where they are just built that way. But if you were to take somebody from a very sedentary culture and bring them over and like have them participate in a European lifestyle, it most likely would be much more healthy for them. So that's possibly just what that was. Or
I
at
think
least
there
like
should be like
what I
brought
would
to
just
like
think.
awareness too, because like the articles talk about like how it is hereditary, and so like if you know you have that like in your blood, like say like I have it and I'm giving birth to a child, like I'm obviously gonna implement changes in their life that would kind of prevent this, I guess, or like just raise them with like a lifestyle that would like accommodate this. And like spread more awareness about that.
I do think that it's like lifestyle, but also genetics, because I know acetabular dysplasia, it was talking about there's 2 different types. Right below that in the article, it says that the acetabular cup is posterolaterally rather than anterolaterally oriented, and at the end of the article there's pictures of it, and also said that there was like a thinner spine of the femur, and then the like head of the femur was like shaped not as rounded, it was more like oval or something. So I think also it is like genetically how the bones get shaped in addition to the lifestyle,
just like their shape.
Which I think is also really interesting. Throughout the whole article it really talked about like the relationship between like genetic and environment factors, which I feel like is a big theme in like science in general, is like nature nurture. So yeah, that's a great point.
No, I really like that.
Well, then they talked about farming and sports too.
Yes.
And how, which that kind of relates.
And like the high mechanical load increases the odds of it. I did think it was interesting. They took 250 male patients from rural general practice clinics, which I thought was interesting because they chose their patient population to be like the working class, not the desk jobs. So I was like, I feel like they are getting a very broad like study done, which is awesome. And it says that I also thought it was interesting because they were like, oh, if you need joint replacement or like have to have hip surgery, you obviously have a higher risk of something happening again. So I think a lot of these people had to have that done, and now they're in their later life having.
My grandpa had to get a hip replacement, and he has osteoarthritis.
Yeah, so I think there's a link for sure. And then right below that article, I know we were talking about this when I first came in. I thought it was interesting that they did a cohort of elderly Caucasian women, it says, and they followed, let's see. Either way, they found that the higher estrogen decreased the risk of osteoarthritis, which I thought was very interesting because I don't know if it was like because I don't know, like it's keeping up with the maintenance of joints or like if it was something that was like from birth, the just shape of their, you know what I mean? So I thought I would have liked to like hear more
like why that
on
is.
Yeah. Because I'm also like wondering because I feel like you always hear about people breaking their hip.
Yes.
And I don't know. Sometimes I feel like a lot of like elderly women.
Yes.
Will about this, but I don't know if it's because they live longer sometimes. So then that's just like.
Well, it's because of menopause.
Yeah.
So with the extreme drop
in
in estrogen, it causes hormonal imbalances, which often includes progesterone and cortisol, which it like increase joint inflammation as well as those are products of like in like your bone. And so like just with that, it's like that's why often like women post menopause they like have a much more high likelihood of like breaking their hip, which it's often like noticed that like just statistically like if for example a woman were to break her hip, it is most likely that within the next like 12 to 15 months she would pass away, and it is just because that is like I guess like a good like image of like your body is breaking down naturally. That is just one key component of it. So
it's showing itself.
So usually like if somebody were to break their hip, they would most likely pass away within the year, which is crazy and you wouldn't really think about that. But
earlier in the article, now that we're talking about the whole women versus men showing symptoms, it said this is like the very first part of it. It talks about how the most severe category of like getting x-rays or radiographic hip osteoarthritis was present 49% in women and only 31% in men. So I was wondering if it was talking about the hip pain and kind of like talking about their symptoms. So I thought maybe because women bear children, maybe that probably puts a lot of pressure and affects
that's a good
pelvis
point.
shape. So I thought maybe that would affect.
I feel like it is the pelvis shape because when you think about it compared to like a male's anatomy, they often come more like cylindrical, but for a woman it is much more their hips are spread out, and so it's like their torso sits between the hips more than a man does. So I feel like because of that it would add more pressure on a woman. But I did think it was weird that like more women commented on hip pain in regards to if they had osteoarthritis than men did, and I think that's so weird.
And then also because like men usually, at least I feel like the older generation now, when they were younger, they had more of the like heavy lifting jobs or like the working jobs. So you'd think that they would. But it goes to show you that genetics and environment both play. So maybe it is.
Because that kind of goes back to the whole farming thing, like those types of
the
jobs.
farming, but then women are giving birth and carrying a child. So it's
so it
maybe it also could simply just be the fact that it is just more prevalent in women. Genetics.
It is.
Like it genuinely could be just as simple as that.
Which I'm just looking because often like if I come up with a question like this, I like to see what it is, and it is particularly it's stating like it most likely occurs women with menopause, and it is because the hormonal fluctuation and like the estrogen drop, as well as just the anatomy of it. So it is kind of just like everything we were mentioning. It's just like a whole lot of factors.
I'm trying to like put that together too because in my health and human behavior class, I'm learning about how like men. And actually, we learned this in our dance class. Men, there's a trend where you can tell a man to sit on his knees on the ground and put his hand on his back, and he'll fall. But women can do it. It's because men carry all their weight in their chest, and women carry all the weight in their hips and their legs, and like this.
And it's just so. I think it is so interesting, like how just like different our like even though like if you see a skeleton, sometimes it's a little difficult to like interpret what gender it is. It's like after a moment like you can really begin to like tell like wow, we really are just like so different and unique. It's so nice and like interesting, and it's just
And in that same part of the article, it said that human genetics are highly, the osteoarthritis of the hip is highly heritable, and it says that genetic contribution in approximately 60% of women based on twin studies. So that was interesting that like a lot of women have this problem when they get older. It also said that it clusters in families, so I kind of wrote a little note. It's heritable, and in the hand hip, in the hand hip, there were family patterns, but in the knee, it wasn't like familial patterns. And my kind of take on that was maybe my original theory was that the knee is very like weight bearing, you used a lot, but then the hip is also, but I think your knee kind of gets affected by lifestyle, more like runners versus not runners, like
taking the stairs,
and stuff like that. And I feel like the hips, when all of us, since we're just bearing all of our weight, I don't know.
Well, the hips also have just like a stronger socket when you think about that. Like it is like
it's a lot bigger. Like
it's bigger, it's more dense.
Actually, well, yes. But earlier in the article, it was saying that joint shape had a lot to do with it. I have torn my labrum so many times because my labral like ball that goes into the joint is smaller than it should be, and so it comes out of the socket a lot. Like I can dislocate it on command, and it'll like tear like so easily. Which my doctors have told me that it is a big possibility that I will get this because of that issue. So. I actually don't know if what I just said was related to what you were saying.
Yes.
I
was saying that I believe that it would be safer compared to a knee. Or it's like just the like the anatomical.
But usually, it's like they like fit like that because it's like stable.
Well, it was also talking about just like with like your bone shape. It was saying that like osteophytes mixed with like the joint space and like the narrowing of your joint space, which those were like I thought it was just crazy talking about like just like how your hip anatomy is like it's basically bony growths that form along the edges of your bone, and then like I would just think like that would like instantly I think like with the bone like the joint narrowing, think about like how that would just tear the cartilage if it's like just like even if it's the smallest little bump, it's not meant to be there, it's a ridge, and it would just cut at that piece. So I feel like that could 100% like relate to that, which is so interesting. Now I'm like more interested on like what could be more at stake like near a hip.
Near a hip.
That's so cool.
I also think maybe since they're talking about it like being a genetic variable, is that maybe the hip was developed earlier in I don't know. Because it's so close
like in the embryonic stage.
Yeah, and then the limbs extend from that. So I'm like maybe if I don't know, genetics had more of a part to play in that.
Or also maybe like on that topic, like this could totally be 100% not true. But like if like during gestation or like while you're in the womb, like if the mother is like doing some crazy activity, like say the hip is trying to grow out and the mom spends 4 hours at a trampoline park bouncing on her stomach, which a good mother would not do. Like it could also like even if she like hits something with her stomach while like the hip is like forming, like it can knock it out of place and then create like all these issues.
Right below that it says that it's all these like genes that are linked are on the X chromosome. So I think with like genetic inheritance, maybe it is more prevalent in women because they maybe only need 1 or 2 copies of it to get this like genetic, you know what I mean? And men it's like they get 1 X chromosome, but it's like which one do they get? So then there's might be lesser of a chance.
No, I thought it was really interesting, like the genetics and the chromosomes.
Yeah, because I know everything is on the X chromosome basically, because it's what
like the embryo develops key building block.
Maybe we can move on to the next portion about bone morphogenetic proteins in the wingless pathway. So that was like the WNT pathway they were talking about. I thought it was really interesting. I know they talked about like 2 main things in the pathway, or excessive activation of the pathway will cause regulating cartilage breakdown and then bony sclerosis. So I think I looked it up, and the regulating cartilage breakdown is regulated by enzymes. So I guess the genetics of that pathway can affect what enzymes are produced, which is how much cartilage gets broken down versus like not being broken down. And then the bony sclerosis was an increase of density and a hardening of bone. So I think those 2 factors together, if let's say we break down a ton of cartilage because that pathway is being overactivated and overrun, in combination with like hardening of bone and being really dense, then we're just gonna get bone on bone, just like grinding and compact because there's no like cartilage to kind of like I guess make that process less friction and whatnot.
Like the synovial fluid and the joint. to help
Yeah.
lubricate the
Yes, the
Grinding,
movement
yes.
and just having that cushion of the cartilage. So I think definitely, I mean, obviously that would lead to arthritis and all that kind of stuff.
yeah. I mean,
Um,
you would think
you
yes.
would be probably uncomfortable and
Yeah.
probably hurt.
Yeah.
And I know they talked about single nucleotide polymorphisms, which is just like a change in one base, and that's kind of like how genetic, I don't know, I guess like variation accumulates. So I guess it really doesn't take a lot for that pathway to get overrun. And I'll say one more thing. It says below that they're kind of working on, it's in clinical development to develop an antagonist, which will kind of like block that pathway, so it kind of like turns it off. So that was interesting that maybe they're looking at like the root cause of this condition, like the more treatment or a preventative-based medicine versus just like here's some ibuprofen to help alleviate the pain that you're getting. So that was really cool.
You know what I'm thinking? Now that you're mentioning, like, it could easily be like we were talking about, like if there's like a lack of like synovial joint fluid and it's just a bone on bone. Like we're saying like, oh, that must be like so painful. We were thinking like women state that they have more pain in regards to having osteoarthritis. Do you think that it is a different type of osteoarthritis that women more commonly get that would affect that like pain stimulation instead of men, or like the women who didn't get that? Because like as we're reading, like there's like issues with just like it's like the primary and secondary. We're seeing how it's like your femoral like networking and like the shape of it, the proteins and like all these kind of things. I feel like it just like it later like it like reinstates like the reason why there is pain. And I think that's also like just another reason why it's like so much more common to research like the WNT pathways, because it was just saying like within like the first section of that paragraph that it become a much more common thing to look into and talk about. And so I feel like just with that, because it's so interesting, like how people like react differently, it is most likely because of different things.
No, that's good.
That is a kind of a good question. It's like, is it different in men than it is in
Mm-hmm.
women? Like almost like different like strains.
Yeah, which like right now I'm just looking at like Science Direct, like I'm seeing it like most prevalent for women to get like osteoarthritis in their knee as well. Wondering why.
That is
It's just these
interesting.
kind of
'Cause
things. It's like
the ASM, this is at the end with like the new technology. How before it was like tested as linear, so like one little section, I think it's of the like femur. So and then now this new technology has emerged where you can like basically it said with this ASM technology it develops a multi-point outline. And so this like captures a global representation of shape rather than a limited subset of components of that shape. So I thought that was interesting, and just like how far we've come.
I think
with
technology is playing such a big role. I also think that I know AI is a big thing right now, and I've done a lot of I don't know, I've had to do like projects and stuff where it talks about like how AI can help diagnose things. So I think there's been a lot of things that I've seen. I've used these programs where it like scans the shape of the bone and it can predict like, oh, in 30 years you're gonna have like down here.
I feel like it talks about that too
a
little
so
bit.
I think it's really interesting that like as we're progressing, we can definitely use our like innovation and technology to go towards these problems. Because I know it says like the shape of the proximal femur is kind of a really big indicator of getting osteoarthritis, and it says that like a large femoral head, a longer, thinner femoral neck. It says it reinforces the idea that hip shape changes predate the development of hip osteoarthritis, because I know there's a debate in the article that was brought up where it was saying, is it because they have osteoarthritis that the hip kind of gets changed shape because it gets worn down? But they were talking about the findings that it's like the shape predates the arthritis, so kind of that's what contributes to it. So
like
that
it was
was
genetic. They were born
I
that
feel like
way.
that it kind of all ties together with like
I think that
genetic
also is
factors.
like mixing both of those, where it's talking about like the pistol grip, whereas like you have a wider femoral neck. I feel like that's also interesting because it's just like one, either way, it's like if something isn't fully formed the way it should have been, you could easily develop osteoarthritis. But it's also just like how you were saying, like it's just like the wear and tear of that, because I could even imagine that like if you have a wider femoral neck, like think about just like the movement, you're going to have a more limited range of motion, and so then it's just like going to wear down if you were to attempt to move it as a normal
person
hip would move there.
Yeah, I think it's interesting. I know it's kind of like a testament to we were made so specifically by
Yes.
creators to work together, which is awesome. But obviously, it's like little not malfunctions, but like little changes can like down the line can kind of like I don't know, tumbleweed
little
into
additives.
big. Yeah, little things can really affect.
Yeah.
Yeah. Let's see. I know it talked about when we were talking about kind of like the genetics and the wingless pathways. It talked about how growth factors are really important in kind of the development of bones and how that can, I don't know, affect getting osteoarthritis later. I know it talked about BMPs, which are like a family of little proteins that are kind of related to the growth factor B. And so I thought that was kind of interesting that it's like so many things are going into it, like hormones and then lifestyle and also like growth factors and how that can directly affect the phenotype of the joint. Which, that kind of goes off the genetic level that we were talking about earlier. I'm just trying to find stuff.
Yeah.
I thought it was interesting. Do you guys know what they meant whenever it talks about the way that the acetabular cup is, if it's posterolaterally or anterolaterally? Is that kind of like the socket in
That's the like
the pelvis? That's
like yes, the tilt of your pelvis. So it's like if it's more forward facing or more backwards facing.
Yes.
Yeah, because even like for me, like I have mine faces inward, so it rotates my hips inwards as well as then like my knees, and so I tend to have common dislocations in the knee because if the hips are faced sideways and the knees face forward and then the feet face outward, it's like it causes a lot of like wear and tear, and you have to be very careful for things like that. So I think that's what it was just talking about. Like it's also just like it's just how they're born.
Yes.
It's how they're born. It's also something that you don't even notice. Like because for me, I hadn't even noticed in my own experience until I was already fully grown, like as a person. Once I was in my adult, like you can go to physical therapy, but it's only so much that it can do when you're fully developed. And so I feel like that's also why we were talking about like it was the European.
Yes.
So the Europeans have that issue. It's just like a genetic thing. It's how your body's built. And and then most of the time I'm guessing they don't really quite catch it because they were saying that osteoarthritis and things like that, they weren't really like focused on until much more recently. So
I also think it also could have like a relation to other like disorders like this, like scoliosis, because my boyfriend literally looks like a girly pop because his spine goes like that, and so it looks like he like sticks his butt out all the time when he's not, like it's just his spine curvature, and so then his pelvis is tilted down, and so he naturally like his hips naturally like rotate in like ever so slightly because of that, and it all started like in his back. So I feel like also like they could be linked in a way that like if you have scoliosis you're more likely to have this or like
Which do you something very interesting. This is actually really funny because like I was speaking to my boyfriend the other day, and like he is a Black American, and I was talking to him. I was like, oh, we're talking about this and talking about joints and things like that, and oh my gosh, look at this, because like he's also a health major, and so he's also very interested in this. And I was like, it's saying that it's more rare in like African men and women and Asian people, and he was like, well, it's most likely often because just from like his family and who he knows, they have much thicker hips. So like how you were saying, your boyfriend has what it seems like to be feminine hips. People in his family and the men in his family, they have like stronger hips. They have very noticeable hips as well as like their glutes as well. It's just it's very like it's very strong because like that whole area is just more dense. So there's more muscle, and it just ends up
which is another reason, definitely, now that you think about it, because it said lifestyle, but my boyfriend's from Europe. He's from Italy, and so like
these things connect.
It's like and it's crazy how like things connect and you don't really think about it. But I was just thinking about that. You were saying that he has this look, which it's also interesting. You were saying he has you said he has like he's got like feminine hips, but as I was saying, like, oh, my boyfriend knows very many like Black Americans who they have what we would consider is like a feminine hip, and it says that it's more rare in African people or like Black Americans, and you're saying it's common in Europeans because it was in one piece. I think that's just so interesting how though like outwardly we look the same.
Also, that's another reason why it would kind of be more common, I guess, is because like we were saying earlier how it would kind of be more common if you worked out, just because like the wear and tear on all like the bones and stuff.
Yes.
But also because when you work out, like especially like legs and like this like region, you build more like body mass,
Yes.
and
Yeah.
that could also be putting more and more pressure on that. So that could also be
Well, I also think
more common.
It
Because
depends
my
on.
boyfriend is a gym rat and he has like
Yeah.
big hips.
Yeah. Well, I was thinking it also depends on if you're doing like functional lifting or if you are
Yes.
doing physical lifting. Because
Like
often, like if you are a
compounds
bodybuilder,
and-
yes,
yeah.
you are
Yeah.
lifting for the appearance.
Yeah.
And
Or
so
the
you are going to
weight
be
and
lifting
the-
very intense.
yeah.
But if you are lifting, like you were saying, Pilates is very functional, and you were saying how you noticed your body changed very positively.
Mm-hmm.
And you felt healthier and you could see the more like tone defined strong look of your muscles. I think it's just also like the way that you lift and the way that you work out, because it was saying I think towards the end of it was just like your lifestyle.
Yeah.
And if you lift like that or do activities that are very like aggressive and overloading, that'll
So if we wanted to wrap this up, I think some key takeaways could
Yeah.
be like to kind of focus on not having like, oh, I'm gonna lay around for all day and
Yeah.
then for 1
Your
hour I'm
lifestyle
gonna do
is
super heavy living.
no,
Like
that is,
I guess trying to like help prevent it, I guess. Just
yes.
yes.
thinking about your lifestyle, and also like sometimes you can't help it. Like sometimes it's just genetic
Yes.
or like
Yeah.
But I do think like if it is a
Cultural.
possible genetic or cultural thing, it's very good. I think we talked about this well in the beginning. It's very good to have like a neutrally active lifestyle.
Mhm.
Instead of like you're saying,
Mhm.
if it
The highs
ranging,
and
you're
lows.
laying down and then you're
I know
going
there's
really
not-
intense on a
yeah.
run. Just naturally walking
I
or
know there's not a
lifting like
cure,
average things.
but like there's like treatments.
yeah.
And so I think bringing more awareness to that, if it's already in genetics,
Mhm.
and just like if you're like predisposed to it, just
Yeah.
being aware.
Yes.
Yeah.
I was thinking
Being
just
mindful.
yeah. Like there's also like full body scans as well.
Mhm.
It's so important. Like it can tell you like every little nitpicky
Yes.
thing about yourself.
Mhm.
I think that would be really great because it's talking about genetics. If you know that in your family has arthritis, or often they have like bone deformities or things like this, or like the osteophytes and things like that. It would just be really good to start that before you even like think of treatment.
Yeah.
So that way you know
Yeah.
how to treat it and what exactly are you dealing with
Yeah.
to then try and combat it.
Yeah,
Yeah.
for sure. Maybe just to summarize what it talks about in the conclusion.
Yeah.
It basically talks about how our bones and our joints go through the dynamic remodeling process, like we were talking about. It's like we're making more bone or making more cartilage and then breaking it down.
Yes.
It's affected by the pathways we talked about. So genetics play a big role. The main point of the article is that joint shape is a really big factor that alters the kind of like process that osteoarthritis develops. So again, genetics, and then we talked a lot about lifestyle and how that can affect it. So I think the key takeaway here is that yes, the article focused on joint shape, but for the studies it talked about lifestyle, activity level really plays a lot. So
Yeah.
awesome.
Yeah. Anyways, that was really cool. That was actually really interesting. I really liked the discussion.
Yeah, we got some
That's
really good points.
Yes, for sure.
Bye guys.
Bye.